Thanks very much. I'm Courtney Van Houtven. I'm from the VA in Durham and also Duke University. I want to start again from a place of where we have already solved all the problems. So what does that ideal world look like? Oncology care is transformed to be fully interdisciplinary, team-based care. It's patient-centered. We consider the psychological impacts of the cancer journey for the patients. The caregivers have been systematically trained. They feel supported, and we know they are very confident over time that they will be assessed by the team to know that they can actually keep continuing to perform their duties. As a result of this transformation, there's psychological safety on the team members, burnout's fallen, patient outcomes have improved, and the healthcare system has saved money. So that's where I think everyone wants to be. How did we get there? I think one way we can get there is by incentivizing and rewarding team-based achievements rather than individual achievements in oncology care. Tony Back talked about it yesterday. This is not a new idea. There's a really nice JAMA Perspective article from Castellino, Wolfson, and Kular talking about this. The idea that we give bonuses to individual physicians for reducing readmissions as a part of a healthcare system rather than rewarding increased adherence to oral cancer medicines, for example, in an entire practice, or looking at the percentage of caregivers who are trained in an entire practice. These are the team-based cares that we should really try to reward in order to incentivize team-based trainings and transforming to interdisciplinary teams. We don't have a gold standard, amazingly, for training interdisciplinary teams that will be sustained, but we have some places we can start. Kathleen Cologne Emmerich and Ruth Anderson at Duke and UNC have developed Connect Intervention. This is an intervention that uses complexity science in order to train interdisciplinary teams to improve their information flow. This has been talked about a lot in the last day and a half. The fact that we need to improve information flow across services to help outcomes and to help patients feel more supported. It's based on complexity science and the whole idea of increasing information flow and including more cognitive diversity in teams will help team members self-organize and figure out the best way to approach a problem. And I think this is so important in the dynamic setting of healthcare. Even though this was developed in a nursing home, the randomized control trial is now being adapted by a team I'm working on with query funding in the VA to apply to multiple clinical settings, and I think it could be adapted for oncology care by tackling a clinical problem that people in your shoes have identified: too many clicks. When's the right time to transition from survivorship care in the oncology clinic to prime care? We've talked about a lot of problems that could be tackled by thinking about information flow and how to better bring people together to solve a problem. In the nursing home, RCT, just as an example, my colleagues have found that this Connect intervention that helps people map what are the information, high quality information flows and what are some of the barriers. They have found that by then tackling these things together and improving the information flow, it's really improved the way the team feels in terms of staff-reported measures of communication, organizational safety climate, better identification of communication weaknesses, and seeking out those multiple perspectives on the team. In addition, as a result of the intervention, the treatment group had more creative care plans, a more respectful work environment, and improved relationships with coworkers. So this seems like a pretty good thing to try to mimic and just implement right away and not keep waiting. How do we know we got there? How do we get to this ideal world where we incentivize and reward team-based training? We need to measure to know where we are. We need to measure employee satisfaction, not just as a performance metric, but also as a part of our research studies to understand how our clinical program may affect the actual employees in any QI issue or even a trial. We need to measure team functioning, work relationships, so that we have the data to know what has changed or not. And I want to turn back to my kind of bailiwick of caregiver training in my 30 seconds I have left, but I might go over. For caregiver training, I really haven't heard over the last day and a half, and again, I'm a real visitor to knowing the ins and outs of oncology clinical practice, so I am taking this very humbly, but I haven't really heard explicit strategies to include caregivers in the healthcare team and what other people are doing, and maybe this isn't valued, but I think one thing we need to know is to have a baseline of what's happening now. So we want to know how caregivers are both being included. Do they feel like the team talks with them a lot, do they feel that people are assessing their own capacity to provide the care that they're providing? I think their providers and teams feel like they are really training caregivers, but it may be that it needs to be longitudinal, that it's hard to take in information in the light of a cancer diagnosis. But in order to really improve care and the contribution of the caregivers who are in the care force, it's really important to understand their capacity to safely provide care, especially as so much high-skilled care and infusions and oral chemo meds are going into the home. Mistakes are going to be costly if caregivers are not properly trained and assessed for their ability to provide the care. I want to offer a tool to understand at baseline what's really happening to caregivers in terms of how they feel they're included in the team, and that's the Caregiver Perceptions About Communication and Clinical Team Members measure that looks at how do they feel included, and has anyone even asked you if you are providing the care that you can provide and also that you prefer to provide? Has anyone talked to you about additional resources in the community, and how are things going for you? So we need to quantify these things in order to really affect change. The ultimate goal, of course, is to improve the care for the person with cancer, but tackling team functioning and caregivers' role on the team is going to help us get to those process measures of showing performance and showing better satisfaction at the workplace, and ultimately, hopefully, that will change to concrete patient outcomes. Thank you.